Good afternoon, everyone. I'm delighted to be here and looking forward to uh, presenting some of this work to you and also hearing from you. I'd love to have a bunch of questions, and perhaps we can keep it to the end of the presentation so that you hear all the content and we can have a good discussion at the end. So let me just start up my slides. Let me share it. Can you see my slides?
Perfect. You got it.
All right. Thank you. So again, welcome to this session on impactful careers in healthcare informatics, analytics, and operations. My name is Rema Padman. I'm a longtime faculty member at the Heinz College of Information Systems and Public Policy at Carnegie Mellon University. And I've been working at this interface of healthcare, information technology, and data analytics and operations over the past 2 decades. So I'd like to introduce these topics to you and also demonstrate how they can be applied and what type of skills you may need in order to start working on these problems. So let's first start with some definitions. The title is really long: healthcare informatics, analytics, operations. So, what are those things? So, let's just make sure that we are all on the same page. So, in the field, we define healthcare informatics as a collaborative activity. It's an interdisciplinary scientific field that involves people, processes, and technology to produce and use trusted data for better healthcare decision making, be it by clinicians, by patients, by family members, by regulatory agencies, by funding agencies, by consultants, by startups. It's a very it's a large number of stakeholders that we bring together in this collaborative endeavor to improve health and healthcare of individuals and society. So the whole science of bringing technology to improve healthcare is what we call the field of healthcare informatics, in very simple terms. And then, so what is then healthcare analytics? Well, that's all about data. How do you acquire the data? How do you manage the data, analyze, interpret, transform so that you can make consistently accurate and good decisions? Again, these decisions might be at the individual level of the clinician, the patient, and so on. It might be at the population level. It might be at the societal level, at the national level, and so on. But it's all about using data in a variety of ways to improve decision making. Whereas informatics is about the technologies that we need to bring to bear in order to really collect and organize and manipulate the data. And the last one that I'd like to introduce today is healthcare operations. And operations is really about designing systems and designing processes so that whether it's for administrative purposes or financial transactions for healthcare management, or even the legal and regulatory activities that create and deliver healthcare services. So when we go to an emergency room, when we go to an outpatient care setting, or get admitted to the hospital, how do the processes and systems work together? The nurses, the physicians, the technical staff, and so on, in managing to help the patient recover from their illness. How do we create the environment and the operational tasks to manage these? That's the healthcare operations. And clearly, I'm sure you will realize that these are all interrelated and they are absolutely essential to make healthcare organizations work. So what I'd like to do is to really take each one of these, give you a very quick example, and then talk about the kinds of problems that we can solve in these three areas, and of course, across them as well. So to begin with, let's talk a little bit about informatics. And this is really what we have seen explode in the last decade or so. This is what we call the digitization of healthcare delivery. And it's been all about, once internet technologies really spread wide.
Because that didn't come through as clearly. I wanted to illustrate how these implicit bias.
I'm sorry?
Sorry about that, Rema. It's okay.
Okay, all right. Yeah. All right. So let me continue then. So this is about, with internet technologies widely deployed, we, started seeing this opportunity to build e-health in key application areas. And the big one that we have seen since 2013-14 is this concept of electronic medical records. So this is really to enable communication of patient data, but in the hospital environment or in the provider, the clinic environment, the systems that are really collecting patient data that is generated as part of routine care delivery, the encounter between the patient and the clinical entity. That's the data that's being collected in these systems. And as you can see in this little figure that I have, this has become multimedia information. It used to be just structured data on paper records, everything written by hand, the medications that is prescribed, the orders that you need, that you're given for getting tests done, your height and weight and name and address and so on. Everything used to be on paper. Now it's all converted to a digital format. And so there is structured data of that type, but there is much more. Now we have digital X-ray, so digital radiology, whether it's ultrasound, CT scan, X-rays and chest X-rays and so on. We have active images, colonoscopy, endoscopy, and so on. And then pathology slides, text data, the reports that come from the radiology department, or the discharge notes from the hospital, or even your progress notes. Every visit that you have with your clinician, they dictate the notes and there's a text report that is created. And then all the signals through the EKG and all the testing that's done. So you can see now that the medical record has become a multimedia repository of patient's clinical information. And then we have, and of course, this clinical information now is also being provided, is accessible to patients through a technology that we call the patient portal. And many of you may already have access to your patient portal, where you can see all this information on your recent visits and tests and medications and so on, and also get reminders. Hey, it's time for you to come in and get your annual physical done. Or get your flu vaccine and so on. So that's on the clinical side of things, your clinical health and demographic and so on. But alongside this development of Facebook and Instagram and LinkedIn and all these social media platforms, YouTube, we are also seeing patients express the need to have social networking platforms that are associated with healthcare information. So this is a platform called Patients Like Me, and this is and patients who have complex health conditions join the groups. So maybe someone who has multiple sclerosis or Parkinson's or Alzheimer's, they join this platform and join a group that is dealing with similar complex conditions and really want to know, how are other people dealing with these? What can I learn about how I can manage my disease by hearing from about both about things that work and don't work from others like me. And this has really taken off in a big way. And there are multiple benefits that we are getting from it too, because patients are actually surprised. I was really surprised, amazed to find that patients are actually willing to put out entire, medical records and all their experiences and their ups and downs and so on this platform to share with others who are suffering like them. And from that data, we are learning new things about medications that might work for other conditions that nobody ever really thought about. And now you can hypothesize that this is there is a link associated with it, and then run a clinical trial that's much more targeted and may really end up in a successful product for a condition that was never anticipated when the drug was created. So these are some ways that the data from this is also being leveraged, but the technology of the social media platform has really taken off in a big way. And then we have consumer, mobile health, mobile apps on consumer devices for helping individuals track. So this example here of WellDoc is really about tracking diabetes on a day-to-day basis. So through using your continuous glucose monitoring or tracking your meals, meal times and meal quantities and the amount of insulin and the glucose levels and so on. It's impossible for individuals to keep track of all this information on a continuous basis, but these apps make it easy to do so. So that's a consumer application, but actually it is not restricted to just consumers. You see also mobile apps that are of clinical grade quality. So clinicians can actually look up the same, CT scans and digital x-rays and so on their standard mobile devices, because the resolution now and the capability of these devices has really improved to an extent that they can utilize it as a review mechanism or a forum. Going beyond that, now we see also coming back to wellness. So all these applications I've talked about using technologies are really to help people manage who are ill, have chronic conditions, complex conditions, and so on. But you can also use it in the context of wellness care. So self-tracking technology, and I'm sure if I were to ask you how many are using Google Fitbit, Apple Watch, and or perhaps even just tracking your steps and your calories and your running and your sleep and so on your mobile device through simple health apps. I'm sure most of you might already be using these. So self-tracking technologies and implanted prosthetic devices, this is what we call the quantified self. That's another set of technologies, Internet of Things devices and sensors and so on that are being used. And then we have the games for health, and gamification has become a really popular mechanism to get patients to engage. So it's great to have technologies, but if patients or consumers or individuals are not really engaged in tracking or monitoring or managing their wellness or their illness, then it's a big challenge. And we do have a challenge with, for example, medication adherence. It has been recorded, studies have shown that in the case of hypertension patients, maybe half the patients don't really take their medications consistently. And that results then in stroke and really many adverse outcomes requiring hospitalizations and poor quality of life. So gamification has become another mechanism to nudge individuals to these better health practices and improve outcomes. And as a result of these, and maybe even just before I go to the numbers, I want to finish up on the technology with these latest developments that are happening in the context of digital twins. As we are moving to an age of personalized medicine, where we see that all the learnings and the practice of medicines thus far has been through clinical trials which work for segments of populations or subpopulations, and then we apply it to that. The learning from that is applied to every individual, and more studies have shown that really you have to personalize it a lot more. The social determinants, environment that the patient lives in, their genetic and environmental history, their clinical and demographic data, and so on, are all important in determining really what will work and what will not work for one individual versus another. So digital twin technology is really being thought about as a mechanism to test if a drug will work in for this individual with these characteristics. So we're really simulating with these digital copies of individuals before it's actually applied to given to the actual person, the real person. And in the process, what we're finding is that, I mean, this data is already 10 years old. I'm sure the numbers are much larger these days, but just in these clinical systems of electronic health records and these mobile devices that are tracking patient data, we are collecting 5 to 10 gigabytes of data per individual in these systems. And this does not even take into account the social networking platforms, the quantified self, the digital twins, and games, and so on. So again, just the takeaway from this is that, yes, we have all of these great technologies that can help individuals track a number of things associated with their health, generating huge amounts of data. But what are we actually doing with this data? So this is about technologies. Now let's take a look at the context of analytics. This is an example from a colleague who really collected this data at a major pediatric hospital, and looking to extract and analyze this data from the pediatric ICU. So you see here that here is a preterm baby who is connected, in the pediatric ICU unit, is connected to a whole host of devices, oxygen saturation monitor that's collecting data at a particular frequency, feeding tube, ventilator that's also running at a different frequency, ECG blood monitors, IV pumps, you name it. You see all of these here, collecting different volumes of data at different frequencies, at different intervals, and so on. And what we find is that even at just 1 to 5 readings per hour, this baby is generating more than 43 million readings per day. And this is just one baby in one day. And many of these babies are in the ICU for many days. So this has what we call big data in the pediatric ICU. How do we process and then analyze and then make sense and then intervene all in real time so that we improve outcomes? In the context of operations, I want to show you an example of continuous remote patient monitoring. And this example is in the context of managing heart failure patients. So there is a big movement these days. We call it hospital at home, where we know that again, studies have shown that the longer a patient stays in the hospital, the more likely it is that they'll pick up hospital-acquired infections and complications and so on. So we want to be able to identify patients early who can be discharged home and then monitor them at home. So what this hospital is doing is to identify patients who've been admitted for due to advanced heart failure condition, and then those patients who are in the highest risk when they are discharged. There's risk of readmission. So these are patients who are highly likely to come back within 30 days because of a variety of complications. And so they want to identify these patients and monitor them very closely so that if they see that these patients are having difficulties maintaining their health status, they could either intervene through medications, they could send the nurses out, or bring the patient back into the hospital. So that's how they identify patients where there is a risk prediction engine in the hospital, which at the point of discharge is giving an alert as to who is at high risk and who is not for readmission. That patient again that's triaged to this monitoring process where they are sent home with a with this wearable device which goes on the chest, and they wear it for the next 30 days. And data. And then they are also being, as every day the nurse will call and say, hey, have you put on some weight? Do you have water retention? Are you having any breathing trouble, and so on? Ask a bunch of questions. The patient responds about with these symptoms, and all this data then goes into a rule-based and analytics platform that is continuously running these machine learning and rule-based algorithms to try and identify patients who might trigger alerts. And these alerts are physiologic alerts. Hey, this patient is having atrial fibrillation. This patient is having really fast heartbeat and abnormal symptoms of symptoms of various kinds. And the patient-reported data also doesn't sound really good. So then the nurse will call the patient, and then if there is a need, call the attending or the cardiac physician, cardiology, a surgeon who managed this patient in the hospital to make a decision. So this is really trying to keep patients at home and keep them healthy, or if they need, and then, early detection of adverse events, and so that they can intervene. So this is an operational task. There is clearly a clinical decision-making component here. But you can imagine, you also need nurses. You need the technology to work together. So there's an IT task force that needs to manage all this information. There has to be help for the patient at home, the medication tracking. So bringing all these all this information together is an operational and logistical challenge. And so this is another example of how, again, technology, analytics, operations are all interoperating. So the takeaway from these examples is really that in each of these contexts, we have huge challenge with consumability of data and decision making. And so, there is, if you go back 50 years, Professor Herb Simon used to be on the faculty at Carnegie Mellon. He was really a Renaissance scientist. He was a psychologist, an economist, a computer scientist, an operations researcher, and human problem solving. And he also won a Nobel Prize. So 50 years ago, he said, in an information-rich world, the wealth of information means a dearth of something else, a scarcity of whatever it is that information consumes. So what does information consume? He said, what it consumes is rather obvious. It consumes the attention of its recipients. And so a wealth of information creates a poverty of attention and a need to allocate that efficiently among all these information sources that might consume it. And this was 50 years ago. And in this day and age, when we are just inundated with information and data from all around us, this has become an even bigger challenge. So, so what we have is that we have a data-rich environment, as you can see with all these devices and information systems and so on. We do have a lot of data available, but analytics and operations and inference poor. What do we do with this data? What can we learn from it? How do we improve operations? What kind of analytics methods do we apply in what context? And how do we really make it available to the decision maker at the right time in the right manner? So that's really the challenge that I hope you will all be engaged in working over your career. So the work, as you can see, it's challenging, but it's also exciting. You change the experience of care delivery for patients and clinicians and families and society. There's a chance to transform healthcare for the better. There are, of course, challenges, and we'll talk a little bit about those. And it's certainly, I just came back from a patient safety conference last night, and the statistics associated with the kinds of errors that happen, medical errors and medication errors and so on, is just astounding. And many of the people who were at the conference really had this mission to try and move the needle. Ever since this was highlighted in 1999 through an Institute of Medicine report called The To Err is Human, in these 20 plus years, we find that the needle has not moved very much. So I think there is a huge opportunity for us to work together to learn how to really change healthcare delivery for the better. So here are some examples, the kinds of questions that we can try and understand through data, technologies, interacting with the decision makers and with patients. On the clinical side, one example is how can clinicians provide personalized treatments based on real-time data? And that's the example I showed you on the pediatric ICU. It's any alert that is triggered, any alarm that goes out. Somebody has to come run, and when they come running, they need to be able to absorb all that data and make a good decision. In the public health domain, well, I mean, we've all just gone through a terrible pandemic over 2 to 3 years. And opioid epidemic is another one. How can we get public health agencies prepared so that they can identify who are the patients who are at high risk, and how can we then alert their providers and their families so that services can be provided for early intervention. So this is both a prediction, it is decision making, and it is logistics in terms of delivering these at the point of need. Then there is the operational problem that is, 80% of care is delivered in the outpatient setting. And we go see after, we make an appointment, we go there, and then we wait. And studies have shown, and some of my own studies that we have conducted using sensors and devices to collect very granular data, show that patients maybe get 5 to 8 minutes of care on average in the outpatient setting, and but they wait about an hour and a half. How do we improve that experience? I mean, does it really need an hour and a half to see a clinician to get a medication refill or to follow up on a visit and so on? And that's when these handoffs from one setting to another is where a lot of the errors occur. And last is, of course, how do we really deploy technology? And really at this patient safety meeting, all the examples that the health systems that were deploying technology at scale to catch these errors before they happen were all about miscommunication, communication challenges, data interoperability challenges with patients with chronic diseases, patients who are admitted to hospitals, and so on. We have the technology, but something is missing. Its communications are not perfect. Data doesn't move across these silos. So we have a good sense of these challenges, and we know that there are technologies to help us address these, but bringing it all together has been a big problem. So here is one example of what we can do with on the analytic side for clinical decision making. Here is, so chronic, just an example of chronic condition, a chronic kidney disease. This is, 1 in 10 US adults have some level of CKD. And the cost for CKD care far exceeds the cost for other chronic conditions. Almost 10% of Medicare costs, even though the percentage of patients with CKD is only about 3 or 4%. And this, so the question that's being asked is, the CKD patients go to their nephrologist and they get routinely, collect data every 3 months. They go for the checkup. So we have a lot of data in the electronic health records. What can we learn from it? The questions that clinicians are asking is, I've had this patient, I've been following this patient for 5 years, but I really have very, very, very little sense. And maybe the patient is stable. But how stable? And is the patient likely to deteriorate into kidney failure? Is there any way to predict? how does the disease progress? And are there differences across different groups who disease is progressing in different ways? And so here is how we can analyze it. We can apply statistical and machine learning and deep learning kinds of methods to really understand. So this is a population that we analyzed of about 2,000 patients. And what we find is that here is this population that we call low risk. That's about 20% of the population. All of them started really at about the same stage at time zero, maybe when they first started seeing the nephrologist. And then over 7 years of tracking their disease through blood tests, we find that 20% of the patients are very stable, and we call them low risk. Then there is about 46% of the population that's medium risk, and their disease is actually deteriorating, declining, is progressing slowly. And then there is, and we call them medium risk. Then there is about 28% of the population whose kidney function is declining quite rapidly, and we call it that population high risk. And finally, there's a very high risk population, it's very small, 7%, who the red line, the red curve, and we see that trajectory, that is really declining rapidly to kidney failure, and they may need to go on a transplant list, they may need to start dialysis, and so on. And how can clinicians use this information? Well, if we can predict early enough within the first year or two that this is the group that this patient is likely to fall into, then they can start acting. They can intervene, change their medications, change their lifestyle, educate, and so on, to see if that trajectory can be modified to a better one. So that's the kind of analysis that we can do with the longitudinal data. Then we can ask also, can we predict which group a patient is likely to belong to, and how early can we predict? So just knowing that the patient's age and gender and race and BMI and their chronic conditions, turns out that we really can predict what's the likelihood that they're going to fall into the very high risk category versus the low risk category. And then that too, we can do it within a year and a half. So this is a tool that can be embedded in the electronic health record, so that when the patient comes for a visit, this information is automatically computed, and an alert is triggered that the physician can read, and even as they are talking to the patient, and then discuss the options, the treatment options of the patient, so that there is a better shared decision making that can be encouraged and instituted in this setting. In the context of public health, this is an application that was worked on by a team of students, master students in our healthcare analytics and healthcare policy and management program. And the problem that they were looking at, working with a client who gave access to the data, and the question they were trying to answer is, can we identify, this is in the context of the opioid epidemic, which we all know that is still continuing to be a significant problem. It's both costly, adverse outcomes for patients, and so on. It's certainly a matter of societal concern. So the questions that the client was asking is that, can we identify the hotspots, counties where this is a big issue? And so we were looking at Appalachia, and where it is fairly well documented that there is a serious opioid epidemic challenge. And so within the Appalachia, that's a large number of counties. Which regions are really at highest risk, and what is really going on there? So, and are there, can we take a look at the claims data, publicly available data, and so on, to identify what are the factors that are really driving this risk in these different places, and then look at interventions that are being proposed, and it's put out there for public comment, and are different counties looking for different types of interventions and resources and so on to address the challenges in their local environments. So this is all data-driven decision making, visualization, analytics that allow the counties, the decision makers, the resource allocation policies, the regulators, and so on, to bring the same data together, but look at it from multiple perspectives. And the students over a semester, 3.5 months, a team of 6 students across the different programs at the Heinz College worked on these 3 challenges: interactive dashboard to look at county level indicators of opioid misuse, look at analytical insights to help target interventions, and then look at what are the needs of different communities as expressed through the public comments. And you can imagine that different counties take this information and then develop policies and actionable tasks for their own environments. So this is at the the educational program, the kinds of problems and solutions that students are coming up with for real challenges out there. This one is in the operational. This example is in the operational setting, and it's also with a local hospital and a real problem out there. And it turns out that when patients are transferred from one hospital emergency department to another, the emergency physicians at the discharging hospital speaks to the emergency physician in the receiving hospital, and they exchange information about this patient and why the patient needs to be transferred. Maybe they need a higher level of care, and then they send the patient across in an ambulance with a bunch of information on paper files. But when the patient arrives at the receiving hospital, that emergency physician who took down all this information may have gone off duty. And so there is nobody there who really understands what this patient, why this patient is here and what needs to be done. So they start the evaluation all over again. So the challenge here was, how do we really make use of this pre-hospital information, that exchange that happened? It's all recorded in a voice. It's a phone call. And so what the students did, this again was a capstone project that I advised here at Heinz College, a team of healthcare analytics, policy management, and information system students. They came together to develop a text analytics platform that streamlines this communication between these emergency physicians, first responders, and the receiving hospital, so that this voice call and the paper and all the clinical information in the discharging hospital's electronic health record is transferred into a simple summary table, structured table that gives you just basic information, age and gender, and what the condition is of the patient. Why was this patient sent from one hospital to another? What were the treatments that were given during the transfer in the ambulance, and so on. And clinicians at the receiving hospital can just take a quick glance at this record, and they're ready to go. So these are tools that, if deployed at scale, can save a patient's life, can save clinicians' time and productivity and outcomes. And we have all the technologies and analytic capabilities in place to actually do this. And so the challenge is really the translation of it. That is, the solutions exist in many of these cases. How do we really make sure that they get deployed in successfully and utilized? So the last point I want to make is really about all the examples I gave really at the clinician level, at the hospital level, at the provider level, and so on. What about patients? What about us consumers? Are there ways that we can get the public and the individual consumer better prepared to really deal with these challenges and And so, this has become really one of my passions over the past few years to really look at the challenges of health literacy in our population. And so we are looking at digital therapeutics or digital technologies that can be developed using all these analytical approaches, AI, ML, statistics, operations, and so on, to address the challenges of health literacy. And let me give you two examples. The first example is really about creating recommendation systems. So how I guess it's not possible to get your input right now, but I'm sure many of you, if not all of you, watch YouTube videos. It is, user-generated content. You can watch movies, you can watch, TikTok and YouTube and so on, where we can people watch for not just entertainment, but also learning about things. And it turns out that health information, one of the, about a large segment of the US adult population goes to YouTube to get health-related information. And there are more than 100 million videos on just health-related topics on the YouTube platform. So my colleagues and I are asking this question: can we extract information from the YouTube platform that are about particular health topics? A patient has been diagnosed with diabetes. Can I learn what is diabetes and what should I be doing with it? And so we are using machine learning methods to curate these videos, because we know that YouTube, these videos, many of them have a lot of incorrect and unusable information, misinformation, and disinformation. So we need to curate these videos so that we are able to extract, identify videos, retrieve videos that really have good medical content. It's understandable, gives you actionable guidance, it is inclusive, it is bias-free, it is has credible content produced by authoritative sources. We have all these requirements that we want to meet. So we are really creating machine learning approaches to curate videos on all of these criteria. And so if I want to find out, how do I do an insulin injection? Earlier on, I would go and talk to a pharmacist, but now I can go take a look at YouTube video. But how do I know whether it's giving the right information? And so if I can identify credible sources of these videos that are doing a very good job, that becomes information that could be part of the prescribing process. So here I go see my physician, and the physician says, along with your medication prescription, here is a prescription to watch 2 videos that tells you what your condition is that I diagnosed today, and here is why you should be taking this medication. And so this becomes what we think of as just-in-time, personalized, contextualized education of the patient. It's not like you are asked to read tons of material, but just information that is relevant to your condition for today. And the hypothesis is that, yes, if we can actually then evaluate them in trials, and we can learn whether this actually changes knowledge, engagement, and learning. But what about children? We don't want to miss out children either. So that's where gamification is being used. And we have a project called the Digital Vaccine Project that uses virtual reality-based immersive mobile gaming that combines AI-based feedback, neurocognitive training, and implicit learning to nudge children toward better nutrition choice, dietary choices, health, physical activity behaviors, health hygiene habits, mindfulness, and so on. And we are running a number of randomized clinical trials in school settings, and an ongoing study now with Children's Hospital of Pittsburgh to help children, to inform and educate children on healthy habits, especially for children dealing with type 1 diabetes. So this is the whole idea of gamification to improve lifetime choices. And so this brings us then to, okay, these are all wonderful examples that you could be solving out there, but what are the environments, the career opportunities where you can actually, translate this to real-time use? Well, it could be in provider organizations, working with public health agencies like the CDC, like the local county health departments, working with vendors, software developers and startups, payers, providers, consultancies, and of course, pharma. That's another big group. So these are all the different ways or different career opportunities that are available for people trained in informatics, analytics, or operations. Not all three, not necessarily all three, one or maybe two of these, but there are lots of opportunities in these sectors of the healthcare industry. And here are some examples. People have students are joining as analytics consultants, data scientists, technical solutions engineers, and so on, depending upon your preparation, your background, educational background, your interest, experiences, work experiences, and so on. And here are some examples of the organizations that our students have joined. Could be a tech company like IBM, Amazon, Google. They all have started healthcare practices, or a healthcare vendor like Epic and Cerner, pharma, and so on. So this gives you just a small sample of organizations where our students from our healthcare analytics and IT program are finding fantastic opportunities to move the needle on the healthcare in the healthcare sector. And the skills that are needed, what the programs will give are really both on the hard skill side, database management, visualization of data, analytics, which through statistics, econometrics, machine learning and mathematical methods, coding and programming, and a large number of hands-on projects that allow you to translate these skills to actual products and actual problems, applying them to problems like the capstone project that I mentioned. And then the soft skills of teamwork and change management, negotiation, and so on, that you need to bring to bear on each and every project, because you're working with different teams across different programs. All the capstones that I advise are really across our healthcare analytics, public policy and management, information systems program. So these teams come together and learn to work together with these and developing these soft skills to solve these really hard problems. And here are some opportunities to do so beyond the classwork, the coursework, and the projects. There are hackathons. There are a number of clubs that allow you to bring in speakers and do outside activities, graduate and the work experiences, even as you are going through these programs. So let me stop there. I know I've covered quite a bit. I'll stop there, and I'd be happy to take questions.
Rema, I'm going to jump in right away, if you don't mind. Hi, everybody. My name is David Eber. I'm the head of admissions and financial aid at Carnegie Mellon University's Heinz College, and I work with Rema and the students in the MS and Healthcare Analytics program. And we have a great question, and this is specific because of our audience today, the Library and Information Science, that is InfoCon 2023. What advice do you have for LIS students interested in pursuing a career in healthcare analytics? And are there specific courses or certifications you recommend? And I know you just touched upon that a moment ago in some of your description of the healthcare analytics program at our institution. Is there any other advice, though, maybe leading up to a master's degree or other options outside of a master's degree that you would point students to?
So mostly the master's programs are gearing up these days to really meet the needs of students with interest in healthcare, but also to develop the skills on either the analytics front or just the data management front or the operational front, or across all of these. So even programs, I think, that started off as certificate programs are now evolving into master's graduate programs, because not only because of the demand, but because of the complexity of the field, that you really need to have exposure to, I listed a number of courses and skills here. To get those skill sets, you really need exposure to, databases, the bread and butter of every information system. these other type of programming and basic statistics and economics to be able to analyze the data and for actionable decision making. So what I mean, I guess I strongly am in favor of programs that provide students exposure to this range of skills through a graduate program.
I have a slightly different slide, Raman, that you had, just a different way to kind of break out some of what's going on within our master's program, just to show the multidisciplinary approach to healthcare analytics and informatics and information technology, and the approach that we take, kind of hopefully summarizing it. So this is for everybody to take a look at. But I also want to share a slightly different way, the complexity of the industry and some of the other career paths that are out there under this kind of umbrella. This is part of a policy and management degree, but you'll see this kind of, there's so many different approaches that you can take in policy, public health, population health, and delivery. So there's just a multitude of paths forward. And then I do want to also point out what it is that within analytics, the many different opportunities and career paths that come about with a degree in this field. So maybe it is, a master's degree or a certificate or some other credential. Certainly, for Rema and I, it's going to be the master's degree. That's where we work. That's where we sit within the university, and we know the value of that deeper education that is provided in a master's program. In particular, with the MSHCA degree, it's a 4-semester degree with in-person study in Pittsburgh, and it requires a summer internship between the first and the second year. And it really is a comprehensive terminal professional master's degree that does allow students so many different new opportunities upon graduating. Many of our students do come from a STEM background. It's not a prerequisite for admission. And you'll see that many different types of roles that our graduates play across the continuum of the healthcare sector. This is obviously a growing field that we are confident you will be able to succeed in.
Right, and also I saw that you have that program project management component there, Dave, and that's one area where there are a number of successful certificate program and project management. The skills are highly desired by industry, and there are programs, short-term programs available to pick up those skills.
Yeah, and it really is, an amazing, you said this before, Rema, that the hands-on learning is such a critical part of the, for a graduate student's experience, especially at our school. And that's something that I would encourage any student who's considering a master's degree or any sort of advanced degree. It's how often you're getting to practice what you're learning in the classroom in real world settings. So much of Rema's program, the healthcare analytics program, is going to be real world application of skills, trying to get your hands dirty while you're in school, whether that's through client-based courses. We have a capstone project, the summer internship, and even many of our students work part-time as interns during the academic year as well. So practicing what you're learning, applying what you're learning right away, especially for someone who's a less experienced student, it helps build their resume. It's more specific examples to provide in job interviews, so it makes you more competitive. But very much, we are very fortunate to be based in Pittsburgh, which is where healthcare is a huge industry. And we have partnered with many of the local organizations to provide those capstone projects and internship opportunities, both academic year and summer, to provide that hands-on experience that is so valuable. And it's a two-way street. The organization that you're interning for or doing the capstone project with, they're benefiting from your knowledge, from your experience, and helping them solve today's and, more importantly, tomorrow's problems. Yeah. So we're in the last few minutes here. So if anybody has any additional questions, I see one other question in the chat, Rema. Are there specific trends or advancements in healthcare analytics that you find particularly promising or challenging particularly in AI and generative AI.
Yeah, everyone these days is talking about both the opportunities and the challenges with generative AI. And, whether it is in the context of day-to-day decision making, whether it is in predictions, whether it is in patient safety. So at this patient safety conference, there were some of the tech companies were there talking about how they are using generative AI, embedding them into their platforms. So Epic, for example, it's one of the largest vendors of electronic health record systems. They are trying to address this issue of clinician burden, because in this documentation has really, burdened clinicians in a significant way. And they're saying that when the encounter is done and the clinician documents the encounter, before the next event happens with the patient, they are using generative AI to really create summaries. And these summaries are really the visit summaries, which is then easily accessible to the rest of the care team. And nobody has to sit down and look through these past years worth of summaries to visits, to reports, to create these summaries. So tech companies are really taking this in a big way to start addressing some of these challenges, the low-hanging fruit, but really takes up a lot of time. And same with Amazon through their cloud services, trying to provide generative AI solutions and capabilities to really streamline documentation burden and prediction as well. But we have to be worried about, the hallucinations, the fake information, and so on. So these are some of the developments, very exciting developments. But at the same time, we need to, take it with a fist of salt. But Gen AI is really, I think, going to impact healthcare in a significant way.
All right. Well, thank you again, Rema. Thank you to our audience for participating and being great and engaged throughout today's session. Please feel free to reach out to Rema with any follow-up questions, and feel free to reach out to me regarding any admissions, financial aid, or curricular questions or outcomes questions for our various master's programs in healthcare analytics, healthcare policy. We do have full-time and part-time master's programs available, as well as a PhD program at Carnegie Mellon's Heinz College. So
Thank you all for hanging in there and participating in this. And please do feel free to reach out if you have any questions, or if you want to have a discussion. If you have, comments, I'd be happy to hear all of those. But thank you very much. And Dave, thank you for this opportunity.
Oh, thank you so much for your time and preparing for today. So great job today. Thank you. All right, take care, everyone. Bye-bye.
Bye-bye.